The time period from birth until a child's second birthday is a critically important period for proper growth and development. It also is key for establishing healthy dietary patterns that may influence the trajectory of eating behaviors and health throughout the life course. During this period, nutrients critical for brain development and growth must be provided in adequate amounts. Infants and toddlers consume small quantities of food, so it's important to make every bite count. Human milk feeding alone is the ideal form of nutrition from birth through about age 6 months. Human milk provides necessary nutrients, protective factors against disease, and other unique immunological benefits. If human milk is unavailable, infants should be fed an iron-fortified commercial infant formula. Once an infant is developmentally ready, foods and beverages should be introduced to complement human milk feeding. These complementary foods and beverages are essential to meet the nutrient requirements of infants starting at about age 6 months and should be selected carefully to help meet these needs. As an infant becomes a toddler and learns to eat a variety of foods, flavors, and textures, the goal of complementary feeding becomes establishing a healthy dietary pattern and transitioning to a healthy family diet by age 2. Feed infants human milk for the first 6 months, if possible. Exclusive human milk feeding is one of the best ways to start an infant off on the path of lifelong healthy nutrition. Exclusive human milk feeding, commonly referred to as exclusive breastfeeding, refers to an infant consuming only human milk and not in combination with infant formula and or complementary foods or beverages, including water, except for medications or vitamin and mineral supplementation. Human milk can support an infant's nutrient needs for the first 6 months of life, with the exception of vitamin D and potentially iron. In addition to nutrients, human milk includes bioactive substances and immunological properties that support infant health and growth and development. U.S. data show that about 84% of infants born in 2017 were ever fed human milk, with only 25% fed human milk exclusively through age 6 months, and 35% continuing to be fed any human milk at age 12 months. Nearly 1/4 of infants were fed some human milk beyond age 12 months, and about 15% of toddlers being fed human milk at age 18 months. Families may have a number of reasons for not having human milk for their infant. For example, a family may choose not to breastfeed. A child may be adopted, or the mother may be unable to produce a full milk supply, or may be unable to pump and store milk safely due to family or workplace pressures. If human milk is unavailable, infants should be fed an iron-fortified commercial infant formula that is labeled with iron, regulated by the U.S. Food and Drug Administration, FDA, which is based on standards that ensure nutrient content and safety. Infant formulas are designed to meet the nutritional needs of infants and are not needed beyond age 12 months. It is important to take precautions to ensure that expressed human milk and prepared infant formula are handled and stored safely. Donor human milk. If families do not have sufficient human milk for their infant but want to feed their infant human milk, they may look for alternative ways to obtain it. It is important for the family to obtain pasteurized donor human milk from a source, such as an accredited human milk bank, that has screened its donors and taken appropriate safety precautions. When human milk is obtained directly from individuals or through the internet, the donor is unlikely to have been screened for infectious diseases, and it is unknown whether the human milk has been collected or stored in a way to reduce possible safety risks to the baby. Proper handling and storage of human milk and infant formula. Wash hands thoroughly before expressing human milk or preparing to feed human milk or infant formula. If expressing human milk, ensure pump parts are thoroughly cleaned before use. If preparing powdered infant formula, use a safe water source and follow instructions on the label. Refrigerate freshly expressed human milk within 4 hours for up to 4 days. Previously frozen and thawed human milk should be used within 24 hours. Thawed human milk should never be refrozen. Refrigerate prepared infant formula for up to 24 hours. Do not use a microwave to warm human milk or infant formula. Warm safely by placing the sealed container of human milk or infant formula in a bowl of warm water or under warm, running tap water. Once it has been offered to the infant, use or discard leftovers quickly within 2 hours for human milk or 1 hour for infant formula. Thoroughly wash all infant feeding items, such as bottles and nipples. Consider sanitizing feeding items for infants younger than 3 months of age, infants born prematurely, or infants with a compromised immune system. Homemade infant formulas and those that are improperly and illegally imported into the United States without mandated FDA review and supervision should not be used. Toddler milks or toddler formulas should not be fed to infants, as they are not designed to meet the nutritional needs of infants. Provide infants supplemental vitamin D beginning soon after birth. All infants who are fed human milk exclusively, or who receive both human milk and infant formula, will need a vitamin D supplement of 400 IU international units per day beginning soon after birth. Infant formula is fortified with vitamin D. Thus, when an infant is receiving full feeds of infant formula, vitamin D supplementation is not needed. Families who do not wish to provide a supplement directly to their infant should discuss with a healthcare provider the risks and benefits of maternal high-dose supplementation options. Even when consuming a varied diet, achieving adequate vitamin D from foods and beverages, natural sources, alone is challenging, suggesting that young children may need to continue taking a vitamin D supplement after age 12 months. Parents, caregivers, and guardians should consult with a healthcare provider to determine how long supplementation is necessary. Supplemental vitamin B12. Human milk has sufficient vitamin B12 to meet infant needs unless the mother's vitamin B12 status is inadequate. This can occur for different reasons, including when the mother eats a strictly vegan diet without any animal source foods. When the mother is at risk of vitamin B12 deficiency, human milk may not provide sufficient vitamin B12. In these cases, the mother and/or infant fed human milk may require a vitamin B12 supplement. Parents, caregivers, and guardians should consult with a healthcare provider to determine whether supplementation is necessary. Introduce infants to nutrient-dense, complementary foods at about 6 months old. At about age 6 months, infants should be introduced to nutriently dense, developmentally appropriate foods to complement human milk or infant formula feedings. Some infants may show developmental signs of readiness before age 6 months, but introducing complementary foods before age 4 months is not recommended. Waiting until after age 6 months to introduce foods is also not recommended. Starting around that time, complementary foods are necessary to ensure adequate nutrition and exposure to flavors, textures, and different types of foods. Infants should be given age and developmentally appropriate foods to prevent choking. It is important to introduce potentially allergenic foods along with other complementary foods. For infants fed human milk, it is particularly important to include complementary foods that are rich in iron and zinc when starting complementary foods. About 1/3, 32%, of infants in the United States are introduced to complementary foods and beverages before age 4 months, highlighting the importance of providing guidance and support to parents, guardians, and caregivers on the timing of introduction to complementary foods. Early introduction of complementary foods and beverages is higher among infants receiving infant formula, 42%, or a combination of infant formula and human milk, 32%, than among infants exclusively fed human milk, 19%. Developmental readiness for beginning to eat solid foods. The age at which infants reach different developmental stages will vary. Typically between age 4 and 6 months, infants develop the gross motor, oral, and fine motor skills necessary to begin to eat complementary foods. As an infant's oral skills develop, the thickness and textures of foods can gradually be varied. Signs that an infant is ready for complementary foods include being able to control the head and neck, sitting up alone or with support, bringing objects to the mouth, trying to grasp small objects such as toys or food, swallowing food rather than pushing it back out onto the chin. Infants and young children should be given age and developmentally appropriate foods to help prevent choking. Foods such as hot dogs, candy, nuts, and seeds, raw carrots, grapes, popcorn, and chunks of peanut butter are some of the foods that can be a choking risk for young children. Parents, guardians, and caregivers are encouraged to take steps to decrease choking risks, including offering foods in the appropriate size, consistency, and shape that will allow an infant or young child to eat and swallow easily. Making sure the infant or young child is sitting up in a high chair or other safe supervised place. Ensuring an adult is supervising feeding during meal times. Not putting infant cereal or other solid foods in an infant's bottle. This could increase the risk of choking and will not make the infant sleep longer. Introduce infants to potentially allergenic foods along with other complementary foods. Potentially allergenic foods such as peanuts, egg, cow's milk products, tree nuts, wheat, crustacean, shellfish, fish, and soy should be introduced when other complementary foods are introduced to an infant's diet. Introducing peanut-containing foods in the first year reduces the risk that an infant will develop a food allergy to peanuts. Cow's milk, as a beverage, should not be introduced until age 12 months or later. There is no evidence that delaying introduction of allergenic foods beyond when complementary foods are introduced helps to prevent food allergy. For infants at high risk of peanut allergy, introduce peanut-containing foods at age 4 to 6 months. If an infant has severe eczema, egg allergy, or both, conditions that increase the risk of peanut allergy, age-appropriate peanut-containing foods should be introduced into the diet as early as age 4 to 6 months. This will reduce the risk of developing a peanut allergy. Caregivers should check with the infant's healthcare provider before feeding the infant peanut-containing foods. A blood test or skin prick may be recommended to determine whether peanut should be introduced to the infant, and if so, the safest way to introduce it. Encourage infants and toddlers to consume a variety of complementary foods and beverages to meet energy and nutrient needs. Parents, caregivers, and guardians are encouraged to introduce foods across all the food groups, including items that fit within a family's preferences, cultural traditions, and budget. Complementary foods and beverages should be rich in nutrients, meet calorie and nutrient requirements during this critical period of growth and development, and stay within limits of dietary components such as added sugars and sodium. In the United States, some dietary components are of public health concern for infants and toddlers. Iron is a dietary component of public health concern for underconsumption among older infants ages 6 through 11 months who are fed primarily human milk and consume inadequate iron from complementary foods. Older infants who are fed primarily human milk also underconsume zinc and protein from complementary foods, and vitamin D, choline, and potassium are notably underconsumed by all older infants. During the second year of life, the dietary components of public health concern for underconsumption are vitamin D, calcium, dietary fiber, and potassium, and for overconsumption are added sugars and sodium. Introduce iron-rich foods to infants starting at about 6 months old. Iron-rich foods, that is, meats and seafood rich in heme iron, and iron-fortified infant cereals, are important components of the infant's diet from age 6 through 11 months to maintain adequate iron status, which supports neurologic development and immune function. Infants are typically born with body stores of iron adequate for about the first 6 months of life, depending on gestational age, maternal iron status, and timing of umbilical cord clamping. By age 6 months, however, infants require an external source of iron apart from human milk. Caregivers of infants exclusively fed human milk should talk with their pediatric care provider about whether there may be a need for infant supplementation with iron before age 6 months. A complementary food source of iron beginning at about 6 months is particularly important for infants fed human milk because the iron content of human milk is low, and maternal iron intake during lactation does not increase its content. In the United States, an estimated 77% of infants fed human milk have inadequate iron intake during the second half of infancy, highlighting the importance of introducing iron-rich foods starting at age 6 months. Infants receiving most of their milk feeds as iron-fortified infant formula are likely to need less iron from complementary foods beginning at 6 months of age. After age 6 months, children have a lower iron requirement, but good food sources of iron are still needed to maintain adequate iron status and prevent deficiency. Introduce zinc-rich foods to infants starting at about 6 months old. Zinc-rich complementary foods such as meats, beans, zinc-fortified infant cereals are important from age 6 months onward to support adequate zinc status, which supports growth and immune function. Although the zinc content of human milk is initially high and efficiently absorbed, the concentration declines over the first 6 months of lactation and is not affected by maternal zinc intake. During the second half of infancy, approximately half, 54% of U.S. infants fed human milk have inadequate zinc intake. Prioritizing zinc-rich foods starting at 6 months of age to complement human milk feedings will help infants meet the requirement for zinc. Encourage a variety of foods from all food groups to infants starting at about 6 months old. To support nutrient adequacy, foster acceptance of healthy foods, and set infants on a path toward a healthy pattern, it is important to encourage foods from all food groups. Because very young children are being exposed to new textures and flavors for the first time, it may take up to 8 to 10 exposures for an infant to accept a new type of food. Repeated offerings of foods, such as fruits and vegetables, increases the likelihood of an infant accepting them. A nutrient-dense, diverse diet from age 6 through 23 months of life includes a variety of food sources from each food group. Protein foods including meats, poultry, eggs, seafood, nuts, seeds, and soy products are important sources of iron, zinc, protein, choline, and long-chain polyunsaturated fatty acids. The long-chain polyunsaturated fatty acids, specifically the essential omega-3 and omega-6 fatty acids supplied through seafood, nuts, seeds, and oils, influence the infant's fatty acid status and are among the key nutrients needed for the rapid brain development that occurs through the infant's first 2 years of life. Some types of fish, such as salmon and trout, are also natural sources of vitamin D. Vegetables and fruits, especially those rich in potassium, vitamin A, and vitamin C, should be offered to infants and toddlers aged 6 through 23 months. The vegetable subgroup of beans, peas, and lentils also provides a good source of protein and dietary fiber. For dairy, families can introduce yogurt and cheese, including soy-based yogurt, before 12 months. However, infants should not consume cow's milk as a beverage or fortified soy beverage before age 12 months as a replacement for human milk or infant formula. In the second year of life, when calcium requirements increase, dairy products, including milk, yogurt, and cheese, and fortified soy beverages and soy yogurt, provide a good source of calcium. Vitamin D fortified milk and soy beverages also provide a good source of vitamin D. For those younger than age 2, offer dairy products without added sugar. Grains, including iron-fortified infant cereal, play an important role in meeting nutrient needs during this life stage. Infant cereals fortified with iron include oat, barley, multigrain, and rice cereals. Rice cereal fortified with iron is a good source of nutrients for infants. But rice cereal shouldn't be the only type of cereal given to infants. Offering young children whole grains more often than refined grains will increase dietary fiber as well as potassium intake during the second year of life and help young children establish healthy dietary practices. Dietary components to limit. While encouraging intake from each food group, some dietary components should be limited. Avoid added sugars. Infants and young children have virtually no room in their diet for added sugars. This is because the nutrient requirements for infants and young children are quite high relative to their size, but the amount of complementary foods they consume is so small. Complementary foods need to be nutrient dense and not contain additional calories from added sugars. In addition, low and no calorie sweeteners, which can also be called high intensity sweeteners, are not recommended for children younger than age 2. Taste preferences are being formed during this time period, and infants and young children may develop preferences for overly sweet foods if introduced to very sweet foods during this time frame. Avoid foods higher in sodium. Sodium is found in a number of foods, including some salty snacks, commercial toddler foods, and processed meats. In addition to keeping sodium intake within the limits for toddlers, another reason to avoid high sodium foods is that taste preferences for salty food may be established early in life. Choose fresh or low sodium frozen foods when available, and low sodium canned foods to minimize sodium content. Avoid honey and unpasteurized foods and beverages. Infants should not be given any foods containing raw or cooked honey. Honey can contain the Clostridium botulinum organism that could cause serious illness or death among infants. Infants and young children also should not be given any unpasteurized foods or beverages, such as unpasteurized juices, milk, yogurt, or cheeses, as they could contain harmful bacteria. Establish a healthy beverage pattern. An important part of establishing an overall healthy dietary pattern is careful consideration of beverages. Water. For healthy infants with adequate intake of human milk or infant formula, supplemental water is typically not needed in the first 6 months. Small amounts, up to 4 to 8 ounces per day of plain, fluoridated water can be given to infants with the introduction of complementary foods. Plain, fluoridated water intake can slowly be increased after age 1 to meet hydration and fluoride needs. Cow's milk and fortified soy beverages. Infants should not consume cow's milk or fortified soy beverages before age 12 months to replace human milk or infant formula. Cow's milk does not have the correct amount of nutrients for infants, and its higher protein and mineral content are hard for an infant's kidneys and digestive system to process. Plain cow's milk, whole milk, or a fortified unsweetened soy beverage can be offered beginning around 12 months of age to help meet calcium, potassium, vitamin D, and protein needs. Flavored milks for children age 12 through 23 months should be avoided because they contain added sugars. Plant-based milk alternatives. Plant-based milk alternatives include beverages made from plants, such as soy, oat, rice, coconut, almond, etc. These beverages should not be used in the first year of life to replace human milk or infant formula. They may come in different flavors, and some forms have added sugars. Unsweetened versions of these beverages may be accommodated in small amounts in the diet during the second year of life, but most have significantly less protein than cow's milk and are not always fortified with calcium and vitamin D. Among plant-based milk alternatives, only fortified soy beverages are currently considered a dairy equivalent. Thus, consuming other plant-based beverages does not contribute to meeting dairy recommendations. 100% fruit juice. Before age 12 months, 100% fruit or vegetable juices should not be given to infants. In the second year of life, fruit juice is not necessary, and most fruit intake should come from eating whole fruit. If 100% fruit juice is provided, up to 4 ounces per day can fit in a healthy dietary pattern. Juices that contain added sugars should be avoided. Sugar-sweetened beverages. Sugar-sweetened beverages, such as regular soda, juice drinks, sports drinks, and flavored water with sugar, should not be given to children younger than age 2. Drinks labeled as fruit drinks or fruit-flavored drinks are not the same as 100% fruit juice and contain added sugars. These beverages displace nutrient-dense beverages and foods in the diet of young children. Infants and toddlers do not have room in their diets for the additional calories from added sugars found in these beverages. In addition, sugar-sweetened beverage intake in infancy and early childhood may predispose children to consume more of these beverages later in life. Caffeinated beverages. Concerns exist about potential negative health effects of caffeine for young children, and no safe limits of caffeine have been established for this age group. Caffeine is a stimulant that can occur naturally in foods and beverages, or as an additive. Major sources of caffeine for Americans include beverages such as soft drinks, tea, coffee, and sports drinks. Beverages containing caffeine should be avoided for young children under 2.